Hello, this is Gantara. I am doing my Foley video validation. I am washing my hands, but for the purpose of this video, I'm using hand sanitizer because there was no sink in that room. I am then going to enter my patient's room. Going to knock, introduce myself, identify the patient with 2 identifiers. I am then going to explain the procedure and ask my patient if they have any allergies to latex, iodine. Going to gather my supplies and equipment, provide privacy. Position my patient. First, I'm going to grab my gloves. So clean technique, positioning my patient. Knees wouldn't go up, so they are just going to be spread open. With my assistant, Holly. I'm going to set up my tape to place the Foley on the leg at the end. I am then going to put my initials, put the date and the time. Place Chuck at the end of the bed for garbage. I'm going to remove my gloves, do hand hygiene, use antimicrobial sanitizer. Then I'm going to start to set my sterile field up. First, by checking the package, making sure it's intact. Expiration date is not expired. Make sure all the contents, everything I need, is on the front of the package. To carefully remove the box, opening the flap furthest away from me, and the sides, and the one closer to me. I'm going to remove the gloves. Just rearrange my sterile field, noting that I have a 1-inch contaminated border around my sterile field. I'm going to put on my gloves, my sterile gloves. Close. I'm going to set up my drape under the patient's buttocks without contaminating the drape. And without contaminating my gloves. And then that's the fenestrated drape, which is used for male. You can use it on a woman, but I prefer not to. I then set up my Foley kit. Just making sure I have all of my contents. Opening up the lube, I'm going to place the tip of the catheter inside of the lube. Just getting everything prepped. Now that I have everything prepped, I'm going to put the box in between the patient's legs so I have easy access to it. Just making sure the tip is on the top so I have easy access to it. So now I'm going to use my left hand. It's going to be my clean hand, and I'm going to open up the labia so I can clean the meatus. And prior to all of this, I would do pericare if needed. So I would do each labias and then the meatus from front to back. Using my sterile hand, I am going to pick up the tip of the catheter. And with my assistant Holly, she will help me pull the lube off. And I am going to start inserting the tip of the catheter into the meatus until I have urine flowing back. Once I see urine, I will then insert it 2 to 3 more inches and then fill the balloon and pull for resistance. And then I'm going to tape it to my patient's legs, making sure that there's enough give without pulling and I'm going to put the bag below the bladder on the side railing of the bed, the side of the bed, not the railing. And then I would clean up my mess, do hand hygiene, document my findings, document how the patient responded, and now I'm going to show you how to remove the catheter. This is clean technique, so I would wash my hands, put new gloves on, remove the tape, holding the skin taut, unflush the balloon, and then gently removing catheter from meatus, holding onto the catheter itself so it will not flop around. And then I'm going to dispose of all my garbage, get my patient back to a comfortable position, clean up, and I would want my patient to void in the next 8 hours, and just keep assessing.